Sure. Good afternoon, everyone. Thank you all for joining Delaware's Resilient and Sustainable Communities League, or RASCL, for our fourth annual summit. Our theme this year is Expect the Unexpected, Planning with Uncertainty. And we kicked off this morning with a session discussing how major unexpected events have compounded over the last year and stressed our resources in responding to them financially. So welcome back for those of you that were there. The next few slides are going to look very familiar to you. My name is Mike Tholstrup. I'm a planner with the Department of Natural Resources and Environmental Control, which is a founding member of RASCL. I'm an AICP certified planner and was recently appointed to the executive board of the Delaware chapter of American Planning Association. I'm honored to host our first virtual summit this year and want to thank the RASCL Steering Committee and our Summit Planning Committee for all the work they've done to put together this timely event and bring an exciting list of panelists to you, how and wherever you are joining us today. For those of you that are not familiar with RASCL, our network represents state government, nonprofits, and academia. With a focus on climate change, we are committed to working together to provide technical expertise and support to Delaware communities in order to increase their capacity to adapt, mitigate, and respond to environmental changes. We're known for hosting community coffee hours throughout the state, sharing news and resources within our network. And for the first time, we've led a successful proposal for a 2020 National Fish and Wildlife Foundation National Coastal Resilience Fund Award for planning work in the Mispillion and Cedar Creek watersheds. Before we get into our session, I'd like to take a moment for technology and housekeeping, just so we can keep things rolling smoothly throughout the afternoon. We ask that you please keep your audio on mute and turn off your video camera for the introduction and presentation portions of the event. This will help with your local bandwidth usage and cut down on screen clutter for those others on Zoom. Renaming yourself on the screen will help identify you to others, and you may include your affiliation. To do that, just use the ellipses at the top right of your video box. We also recommend selecting speaker view at the top right of your screen to highlight each presenter in the session. During the session, we have moderators designated in the chat box. So when you have questions, we ask that you use a chat box and send them to our questions moderator. And for help with technical issues, you can chat directly with our technical support moderator. Helping to make today's event possible, of course, is our sponsors. At the friend level, we'd like to thank the professional architects and engineers at GMB. I'd also like to thank the Delaware chapter of American Planning Association and the University of Maryland Environmental Finance Center for your support at the fan level. This afternoon's session is the second of the 3 summit webinars titled Understanding Social Stressors and How to Factor Them into Community Resilience Planning. We have a moderated discussion for about 50 minutes, which will include time for audience questions received in the chat box. You'll then have time for a 2-minute stretch before we break out into smaller groups for about 15 minutes of facilitated discussion on related topics, and we'll conclude the webinar at 3:30 this afternoon. As you can see, the 3rd webinar in our series will be held tomorrow afternoon, starting at 2 p.m. And please remember to use the Zoom link provided for that session, as they are different. I have a few things I'd like to note before I introduce our moderator. Today's live presentation and Q&A will be recorded and made available on our website along with the presentation slides. We'll also follow up with each of you to share resources referenced during the summit, contact information for our speakers and attendees, and the all-important feedback survey so you can tell us how we can improve our process. Professional certification credits for PE, CFM, and AICP are available for each of our webinars as well. And finally, for those of you still keeping track of Delaware's first climate action plan, it's slated for release this winter. The plan will focus on 2 types of actions that minimize greenhouse gas emissions and actions that maximize resilience to the climate change impact we're already experiencing. And you can find out more about that at declimateplan.org. All right, and with that, I'd like to introduce our moderator for this session. Lisa Locke is the Director of Programs for Delaware Interfaith Power and Light, a religious response to climate change. She's a transplant from Michigan with a background in church administration, grassroots environmental work, and sustainable business coordination. She's also a member of the RASCL Summit Planning Committee. So Lisa, with that, the panel is yours.
Well, thank you, Mike. So it is a pleasure to be here today, and welcome to all of you who are joining us. And I do want to give a personal shout out to RASCL. This is such an impressive group of knowledgeable and creative and collegial and impassioned people. And it is a delight to work with them, and I feel Delaware is really fortunate to have this resource. And we are very fortunate to have 2 great presenters for this session on understanding social stressors and how to factor them into our community resilience planning. So of course, we are all experiencing social stressors these days, but some of us much more broadly and profoundly than others. So we have so much to learn, untapped potential and connections to be made, and inequities to address and rectify. So before we get started, I do want to do a quick review of the timeline Mike mentioned, but our presenters are each going to take about 15 to 20 minutes, and then we will move on to the question and answer period for about another 15. Feel free to enter your questions at any time into the chat box. And then after the Q&As, we will take just a few minutes to get the room set up, move into small discussions for another 15 minutes, and then come back together for closing remarks. So be sure to stick around for all of that. And now I would like to introduce our presenters today. Tiffany Ganthier is an Institute Associate at the Georgetown Climate Center. She provides legal and policy analysis on adaptation projects at the federal, state, and local levels, focusing specifically on equitable adaptation, and is the project lead of the Equitable Adaptation Legal Policy Toolkit, which you'll be hearing about. Patty Drago, now happily retired after a challenging career in commercial property and casualty insurance, is serving as a member of the coordination team for the CAPE Community Coordination for COVID-19, which you might have heard of. It's CCC for COVID. And this is a coalition of civic and community organizations in the area that is served by the Cape Henlopen School District in Sussex County. And they are coordinating a local response to the COVID-19 virus. So now, Tiffany, I would like to invite you to take the screen.
Hi, everyone. Is everyone seeing my screen okay?
Yes.
Great. Okay, so hello again. My name is Tiffany Ganthier, and I'm an associate with the Georgetown Climate Center. And as Lisa mentioned, my work focuses on equitable adaptation. So just to tell you a little bit about GCC, so since 2009, the Georgetown Climate Center has served as a resource to federal, state, and local governments working to reduce emissions that cause climate change, and taking steps to make sure that their communities are more resilient as well as they adapt to the impacts of climate change, as well as mitigate climate change impacts that are already happening. So we're based at the Georgetown Law Center in Washington, DC. And that's just a little bit about what we do as a center as a whole. So I'm working with the adaptation team, and we focus solely on climate change impacts. So climate change is often described as a threat multiplier, and this applies to social inequities. With the changes that we're seeing driven by a changing climate all over the country, it's important to acknowledge that climate impacts especially affect those already suffering from cumulative burdens of pollution or racism and political and economic marginalization, as well as many other social impacts. So longstanding discrimination means that Black and Brown communities are often situated in less desirable flood-prone areas, for example, and neighborhoods that were subject to redlining in the past have more concrete than green space, making them more vulnerable to extreme heat, which is one of the deadliest impacts of climate change. So those are just a few examples of how climate impacts are affecting certain communities more than others. So while there is much that we can still do to limit climate change scale and impact, our previous carbon emissions guarantee a warmer and more disaster-prone world for years to come. So inequity, on the other hand, is a choice, a condition that flows from countless policy decisions. As we brace for climate change, we can choose to share risk and rewards more fairly and protect those who are most vulnerable to an uncertain future. So thinking about the practice of equity, it requires a recognition that we are not starting from the same place, given historic and present systems of oppression. The inequity is not inherent to the individual. People are disadvantaged by uneven playing fields. So the inequity is really in the context, whether that means a race or your disability or plenty of other inequities that are existing. Equity is about reapportioning or redistributing resources so people can access opportunities. And justice is about dismantling barriers to those opportunities. So that's how equity and environmental justice issues kind of play together. So justice involves dismantling systems of oppression and privilege that create systemic disadvantages and barriers to people's ability to access resources and opportunities. So GCC developed, we worked on developing the Equitable Adaptation Legal and Policy Toolkit over the past 2 years. So for communities to truly be resilient to climate risks, they must have the resources to prepare for the coming changes. So as well as the ability to withstand impacts and recover quickly after an event. So that means reckoning with racism and other inequities that put some people at greater risk. This subject is more relevant and more urgent than ever. Even as the effects of climate change are more obvious and more urgent, the consequences of this country's history of discrimination are also in the forefront of our minds as we focus on our national dialogue. So what we sought to accomplish in compiling this toolkit is to both define what it means to take an equity-centered approach to prepare frontline communities for the realities of climate change, and provide examples through our case studies of how state and local planning professionals all across the country have implemented the legal and policy tools to achieve equitable outcomes. So the toolkit is intended to aid local governments and community-based organizations nationwide that are focusing on centering equity in their climate adaptation and resilience initiatives, and most importantly, for local governments and community-based organizations to work together. The toolkit explores best practices and case studies from a wide variety of cities, all different sizes, and draws lessons from those different approaches. It also provides frameworks to help people tailor legal and policy options for their own jurisdictions that advance equitable responses to the impacts of climate change. So what's in the Equitable Adaptation Legal and Policy Toolkit? So basically, in practice, building equity into climate resilience planning and implementation involves not just addressing the disproportionate impacts, but also working to dismantle those barriers. So the toolkit focuses first on delivering diverse and inclusive engagement processes, and that can be found in the procedural equity section of the toolkit. And then the second big focus is substantive equitable outcomes. In other words, actually implementing policy solutions and programs that seek to more fairly distribute access. And finally, there's a funding and financing tools section, which provides more detailed information about practical legal and policy options for decision makers and communities to make sure that they're actually able to actually ensure those resources reach the communities that need them the most. So in the procedural equity section of the toolkit, there are 3 chapters that explore tools that can be used to achieve procedural equity. And that's one is community engagement and social cohesion. And there is a chapter on governance and budgeting. And there's also a chapter on data metrics and monitoring. So I'm gonna focus on 2 of these chapters today. So the data metrics and monitoring chapter explores quantitative data, collecting and applying qualitative data, and participatory data collection and technology access. All of these data implications are needed to make sure that we're grounding our decisions of policy decisions, program decisions in real data and real fact. These different types of tools are needed to be used in concert and not separately. So one example of a case study that can be found and featured in this data metrics and monitoring tool chapter, which will likely be under the quantitative data piece of it, is the Social Vulnerability Index, which you'll hear more about from Patty. But it's a program that layers geospatial data with 15 US Census variables to provide policymakers with the tools to analyze a community's socioeconomic vulnerability to potential environmental hazards and disasters. So if you go to the resource, you'll basically see a full summary of the resource, which is about a page long, so this is about half of it. It'll tell you how to potentially use that resource, and then you can go directly to the actual resource. So it takes you to the actual tool. You can find your state or your community, and here I took a screenshot of the state of Delaware to see how they're ranking as far as their indicators. Another example is the Maryland EJ Screen tool. So I got to work with the Prince George's County Environmental Justice Commission in Maryland, and we use this tool to actually make some decisions on environmental justice issues in the county. So the Maryland EJ Screen tool is an example of a social vulnerability index tool, but it goes into a deeper dive into Maryland and the actual problems directed in the community. So the tool uses geographic information system and public participatory GIS mapping tools to calculate Maryland EJ scores for each census tract. It can be very similar to the EPA's environmental justice screening tool or the California tool, but it's again specific to Maryland. So we definitely encourage more states to tackle these types of tools and make them very specific to their own communities and explore sensitive populations and socioeconomic factors to be able to calculate the population characteristics and score of each community. So these scores are used to make policy decisions as well as project decisions, funding decisions, and can back up a lot of decisions on the state, local, and municipal level. So these issues are very important, and Maryland has been using this great tool to make those decisions. So another chapter is the community engagement chapter. In that chapter, a key component of equity is community engagement. So the chapter is located in the procedural equity section of the toolkit, and it highlights principles and action items on how to effectively engage the community in adaptation processes. So we broke it down into 5 principles, but in addition to that, there are several different case studies, actually over 130 case studies in the whole toolkit that shows communities as well as local governments working directly with the community or through a group or through a commission like the Prince George's County Environmental Justice Commission, and showing how they were able to effectively engage with the community. So one example of a case study found in this chapter is a citizen science case study. So if you'll go to the chapter, here are some of the case studies that are featured. So you get a quick summary of it. You click on view resource, you'll get a full summary of it, and then you'll get a link to the actual resource. So this case study is mapping urban heat islands in Richmond, Virginia. So to identify excessive heat and how it might affect the neighborhood's most vulnerable residents, researchers came up with a way to check local temperatures using citizen science. So block by block across the city in collaboration with a group called Groundwork RVA, and they were actually students. So these are high school students, college students, were going around during heat waves and taking temperature checks all around the city. The study found that the same downgraded neighborhoods have higher temperatures during summer heat waves, affecting the health and wellness of residents in Richmond. And many of urban centers that were redlined across the United States matched those same downgraded neighborhoods as far as heat temperatures. So ultimately, low-income residents and people of color didn't end up in these areas by choice, but they must now contend with the threats to their health, safety, and economic prosperity brought by changing climate. The legacy of government-enforced racism and depressed homeownership rates amongst people of color lives on, as shown in the studies across redline urban cities. The Science Museum of Virginia, his name is Jeremy Hoffman, compared the redlining maps to today's urban heat island maps, showing that government policies and programs created the segregation, the disinvestment, and the wealth gap that still exists today, which also created health issues. The results of the study were strongly considered in the city's climate action plan and green infrastructure planning to make sure that they invest in the parts of the city that have long been disinvested. So this mapping inequality project has actually been done in almost every major city across America, and it's been almost the same exact outcome. The places that were once redlined are also those dealing with issues like asthma, urban heat, being uninsured, and plenty of other issues. So another major overarching section of the toolkit is the solutions chapter of the toolkit. So these are 7 chapters that focus directly in subject areas as seen here. So one example of these are the components featured in the disaster chapter. So that's one that I'm going to zoom in on that uses a lot of data and metrics to make those decisions. So the disaster chapter goes into 5 legal and policy tools, including planning tools, equitable opportunities for relocation, supporting the development of resilience hubs, equitable recovery tools, and funding tools. And then there are several case studies listed under each legal and policy tool. So every subject matter chapter is basically formatted the exact same way. So here's how you can kind of navigate through those. In that chapter, one of the case studies that we highlighted is the Baltimore Disaster Preparedness and Planning Project, also known as DP3. So this project shows that Baltimore is at risk of hazards like flooding, precipitation variability, and coastal hazards like tropical storms and hurricanes, sea level rise, and tsunamis at some point in time. So the 2018 revision of the Baltimore Disaster Preparedness and Planning Project, DP3, has identified Baltimore's vulnerabilities to hazards, including those impacts. The hazard mitigation plan focuses on developing strategies that should reduce or eliminate the loss of life and or property damage within infrastructure, buildings, natural systems, and public services. So most cities are required to do this kind of disaster preparedness planning, but this project connected the latest scientific research on climate hazards with community-based outreach to identify the priority strategies for hazard mitigation in Baltimore. So the updated plan added a strategy subcommittee consisting of agencies responsible for implementing the actions and an equity and outreach subcommittee to engage community members with an equity framework for residents most vulnerable to natural disasters. So the 2018 DP3 version, which is updated every 3 years, places a stronger emphasis on community engagement and equity than previous hazard mitigation plans. So the DP3 offers several specific strategies to increase social equity in Baltimore, such as prioritizing retrofitting and increasing the resiliency of public housing units in designated flood areas and other high-risk areas based on the maps. Prior to hazard event, identify lead contacts serving vulnerable populations and giving increasing premiums and identifying programs and grants that assist citizens in purchasing flood insurance and making flood proofing changes. So that's one way that Baltimore has used an existing mechanism and incorporated equity principles in order to make it more equitable for all residents in their city. So that's the end of my presentation. Thank you all for listening, and I hope that you guys actually check out the toolkit. There are plenty of different areas that I obviously could not have gone into, and there's so much more that we could talk about as far as different subject areas and conditions that come out of those countless of policy decisions. So as we brace for climate change, I hope you choose to share the risk and rewards more fairly and protect those who are most vulnerable in an uncertain future. Thank you.
Well, thank you, Tiffany. That was excellent. Really giving us this kind of broader, higher level view of what we're going to be delving into a little deeper, and really underscoring, I think, that need that we really need a much better understanding of resources being both equitable and accessible. I think that's such an important point. And that we have the tools and the policies to support all that. So, but with that, I would like to invite Patty to take us into a little deeper dive here, maybe.
Okay, just doing a screen check and a voice check. Okay. Hello, everyone. Again, I'm Patty Drago. I'm part of the Cape Community Coordination Team for CCC for COVID. What I'd like to do today is talk about a real-world application that we were involved in for the last year. This organization is fairly new. I'm going to first give some background on CCC for COVID and then delve into one of the more urgent challenges that we faced at the outset of the pandemic, and how integrating social vulnerability factors increased our understanding of the issues and helped us make better decisions. So a word or two about Cape Community Coordination for COVID. We started in March of this year with 12 partners. We now have more than 80 plus nonprofits involving social services, senior services, the faith community, businesses, the school district, DEMA, FEMA, and a number of state agencies at this point. What we do is coordinate the local emergency response amongst the community organizations to leverage the skills, resources, informations, and logistics available so that we can extend those more broadly. And how we do this is primarily through networking, facilitating communications with our partners, making sure that everyone understands who can do what, who is doing what. We identify critical needs, conduct research. I'll come back to that in a minute. Tiffany talked about the importance of also having data when you're working on problem solving, identifying opportunities and collaborating to solve problems and deliver the most effective solutions. Our short-term objective is to address the needs during the pandemic by stretching the collective reach of resources to adequately serve vulnerable populations. Our long-term goal is to shed light on social needs, the inequities involved, and their impact so that we can influence planning and policy and get local needs on the map. You cannot effectively manage a crisis if the vulnerable population does not have a seat at the table. So here is what we found. Oh, I'm sorry, I went one too far. Let me do this. Sorry. Our impacts to date. Let me talk about that first. We've made a number of beneficial impacts to date in health, connectivity, and navigating access to resources, a constantly changing array of resources as the pandemic has worn on and on. Today, I'm going to focus on one piece, and that's the nutrition piece, specifically the adequacy and efficacy of the emergency food resources. The pandemic threw this issue into sharp relief. Millions of people countrywide have now turned to food banks for the very first time in their lives and having a lot of difficulty navigating that process. It's also heightening the systemic stress. We saw the opportunity for collaboration to ensure capacity, to ensure greater efficiencies, and to have a more effective reach. But first, we had to understand the landscape. Who and what was out there doing what? Where were the opportunities to close the gaps, reduce redundancies, and improve efficiencies, and how best to reach vulnerable populations to communicate the availability of these resources? And what we found was this. I needed to find a way to convey graphically what it felt like at the beginning of this process. It was literally overwhelming. We identified a lot of disconnected, jagged pieces, turned up a mess of issues that would need attention if we were going to make any kind of a dent. So our first step was to organize this process. And here is how we began that. First, we sorted all of those components into barriers, resource adequacy, inefficiencies, and knowledge gaps. Some of the barriers we confronted involved access because of fear as one example, or language barriers, which was often tied into the fear component that gets into some of the social vulnerabilities. There were also issues with lack of internet connectivity and devices in certain areas, which would influence our communications program, as well as mobility, where households may not have had access to a vehicle. On the resource adequacy front, I don't think I need to talk too much about that. All of us are familiar with the supply chain disruptions that took place at the initial stages of this pandemic, and that we suspect may hit again here and there, not just in terms of commodity resources, but in terms of some of the services that were tied into those resources as well. We found issues with clean drinking water. We also uncovered efficiencies. I mentioned many people new to the process didn't know how to navigate. We were finding some clients were driving long distances. Individual food deliveries on one-off basis were being made by the school district to homeless students and by some of the shelters to some of the homeless people who were sheltered in some of the motels over the wintertime. We also realized we had knowledge gaps. We weren't clear on the continuity of the school lunch program in the early months, as well as through the summer when the schools would normally be closed, or the adequacy of emergency food resources. We didn't know all that was out there or the overall extent of need. And so our process began with our partners. We spent time networking, understanding what the demand on them was, what their resources and logistical capacity was, and what their obstacles were. And then we turned to research. This gets to the point that Tiffany made a little while ago, and that we needed to have data in order to understand what we were dealing with and what might help influence better decisions. And so on top of the information we received from our partners, we researched relevant statistical data. The US Census Bureau has a very robust data tool at data.census.gov. And there are links to all of these research tools at the end of the presentation, which RASCL will share with you. And we found that to be very helpful in getting the lie of the land in what we were dealing with demographic-wise. But we found we also had to do a lot of boots on the ground. We knew about our partner services, but we also knew there were other emergency food resources out there. And the only way to do that was literally go to the phone book and identify churches, senior centers, and other likely institutions that we could call directly, and to add to our base of information to say who's out there, who's providing food services, meals, small pantries, large pantries, or school meals, backpack programs. Once we had all of that, we turned to mapping tools, and our very first priority was at a very simple level. We wanted to put together a public-facing map for electronic access. One of the deficiencies that we found was that there were some statewide maps dealing with food resources, but they were very skinny on Sussex. There wasn't a whole lot represented on those maps. And so if our residents here in Sussex went to those maps, they weren't going to find an awful lot. So we wanted to get a map out there as quickly as possible. We found an easy tool for that. And then one of our partners suggested that we work with University of Delaware, and they connected us with Nicole Minnie at the Institute for Public Administration to help us in building a much more comprehensive map, an analytic tool where we could spatially visualize all of the info and data we collected. And then on top of that, then begin to overlay some of the statistical data we had, as well as the social vulnerability variables that Tiffany had just talked about. And then further customize that as we learned. We are by no means experts in this area. And as we went along, we began to understand more clearly the kinds of statistical information and social vulnerability aspects that would be more meaningful when dealing with the emergency food resources. And then from all of this, the networking with the partners and the research and the mapping, it helped us then focus on communications where we can determine how to optimally get information out to the public and back to our partners so that we could continue to assess what was working, what wasn't working, and improve what we were doing. And so I'd like, this is the first iteration of the map that we had developed. On the left-hand side, you'll see this is what I call the simple, easy map. It's public-facing, single function, a simple user interface. There is actually a legend off to the side where a user can see, based on the color of the markers, whether they're looking at a pantry, school meal program, or hot meals service that one of the social service entities might provide. And all they would need to do, and I just pulled up one example there, by clicking on one, this little box will come up and give them everything they need, the contact information, the days of the week, the hours, et cetera, so that the public who has a need can easily find locations that are closer to them, make it more efficient, and find what they're looking for. On the right-hand side, we took the same data, and Nicole worked with us to plot this on an ArcGIS map, which allows us, it's a much more robust tool and allows us to incorporate many other layers as well. So this is our base map that we started with. And what we have here are all of the emergency food distribution and meal locations plotted. In addition to, we can drill in by county, school district, municipality, community levels, and other types of data. The area that you see outlined is CCC for COVID's handling territory. But I would say that once we began to get into a rhythm on the data research, we decided that whenever we did research, to the extent possible, we would do it for the entire county. And so you'll see outside that demarcated area, a lot of other facilities located south of us and west of us as well. And then, so to take this to the next step and to understand more clearly, what do we have here? Is it working? Do we have deficiencies or gaps? We needed to overlay the social vulnerability factors. And I'm going to take a little side trip here just to briefly go over what the social vulnerability index factors are. These are factors that sum and substance weaken a community's ability to prevent, withstand, and recover from suffering and financial loss. The CDC, the Center for Disease Control, they have a GRASP program that uses census data to determine social vulnerability. The census tracts are ranked on 15 social factors, and you'll see those lined off all on the left-hand side of the screen, from below poverty to unemployed, down to minority, to multi-unit structures, to group quarters. What was interesting to me that jumped out at us very early on was that internet connectivity was not among those variables. And I'm going to ask you to hold that thought. It becomes important later for our initiative. But in today's world, where I would consider that a utility and a necessity, especially during the pandemic environment we've been dealing with, we realized that we had to go down a sidetrack to investigate and research that data as well, so that we could understand how it might influence our communications. So you've got these 15 factors. Each of these variables, by the way, is rated on a scale of 0 to 1, 0 meaning no risk and 1 meaning the highest risk for a community. And then what the CDC did is they took these factors and they roll up into 4 themes: socioeconomic status, household composition and disability. And as you can see, that's more about the demographic characteristics of the household, minority status and language, and housing type and transportation. And then those 4 themes roll up into an overall vulnerability factor that also operates on that 0 to 1 scale. And so when we talk about, I'll use the term SVI, the Social Vulnerability Index, that's the topmost number on the left. Your themes are the 4 in the middle, and then your factors are the underlying variables that constitute each one of those themes. And so we took these, we took the top social vulnerability index factor and we superimpose it on that map that I just showed you. And now you can see how that begins to play out. And I'm going to start inside the district. I think I can spotlight here. Okay. If you can see, this is where we are. So our initial observations, and remember I mentioned earlier that we could lay on additional information such as communities, zip codes, census tracts, et cetera. Hopefully you can see on this map, there are these little, I'm going to draw some circles around them. These little yellow outlines, these are actually communities, and having the ability to have these communities demarcated on the map turned out to be very handy for us. Our initial observations for the district were that we had a fairly low SVI overall. You'll see, of course, that the social stressors increased dramatically as you move to the western part of the county. But we did see a significant pocket of risk around the Georgetown area, part of which overlapped into the district that CCC for COVID was overseeing. And so I want to jump to the next slide to drill in on that just a little bit. Because there's some interesting things here as we got to dig deeper in this. If you take a closer look at the area, here's what it tells us. If you first of all, if you click on that, this darker area that we were concerned about here, you just click on that, this pop-up box will come up and it will tell you the overall social vulnerability index score, which of course in this case is 0.95, which is horribly high, meaning a tremendous amount of risk in this entire darker blue area. It also will give you a bar chart, because having the index alone isn't going to help you. You want to understand, what is driving that. And the bar chart will give you the index factor for each of those individual themes. Now here, I went ahead and clicked on one particular theme. I clicked on the minority and language theme, which was scored high risk. But that theme has 2 variables, the percentage of minorities in that particular area and whether there's a language barrier. Those are not necessarily identical. We found in our investigation of many of our census tracts in the area that we had a number of areas with a high percentage of minorities, but a low percentage of language barrier. But in this case, unfortunately, we were dealing with a much higher percentage on the language barrier, which was close to the 20% mark. And so we pursued that by then going back and setting the map levels to include the individual themes so that we could get the score detail down to the level of the individual factors. We found that this particular place had 50% plus of minority population, and 20% plus had a language barrier, high numbers that deserved further attention. So we also drill down, of course, to the housing and transportation score, because we wanted to understand household mobility, as that would help inform whether, if we had to go the route of adding a pantry capability, would a fixed location be okay, or would it need to be mobile because people could not get to a fixed location? In any of these areas, you can go back and set up the map to include the 4 individual themes in addition to the overall social vulnerability index. The pop-up data allows you to page through screens for each of these themes, and each of them would have a similar bar chart then showing the scores for the individual variables that make up the themes. So you can drill down to an extensive level in order to understand what's really happening in this particular census tract area. What's most interesting here, though, is that you have to stop and take a look, and you'll note that one thing is missing here, and that is that there are no built communities. And so when we saw that, we realized that we either had a lot of farmland in this area, and that it's happened to be contiguous to a tract where these other residential buildings are located and communities, either that or very sparsely populated. At that point, the map isn't able to give us a whole lot of additional information. We could circle back to the school district to find out more information about what the student population might be there, or simply boots on the ground and get a drive-through to get a firsthand feel of what was going on in this particular area. But it was one way of helping us to understand if we had issues, how do we drill down, how do we get as much information as possible before we start to think about what the responses or action might be. We also learned this red dot is a pantry, a mobile pantry, that in this area, we had nothing originally, and it was further up on a more moderate to moderately high level on the social vulnerability scale. And so we realized, and we also found that we had a higher minority population, less of an issue with a language barrier, but more of an issue with transportation availability. So we realized we needed to do something, and the group worked together to put a mobile pantry in place with weekly deliveries. So that was just another way that this was able to help us. So I want to go back to the prior chart map that we had worked on, because there was one other point that I wanted to make. If you look at the box on the left-hand side of the screen, I talked about the idea that it's not just about the social vulnerability index, but you're able to layer on additional information that could be relevant to the particular problem that you're working on, that you need to make sure you're including to get a full 360 view of what's going on in your area. And there were smarter people than me on this, because they realized that we did need to incorporate other relevant social structures, stressors, like deep poverty and percentage of school children in poverty. This district, our district on the map at first glance, because of all the lighter shaded areas, appeared to be in decent shape. But let's see what happens when we examine school children in poverty. And you see all of a sudden, the environment changes and we have a different overlay. This is the percentage of school-age children in poverty, and a much different, more concerning picture emerges. Within the Cape Henlopen School District area, nearly 15% of the student population lives in poverty. And as you can see by these other numbers, that the problem worsens substantially as you head west. And that's one example of pointing out that the social vulnerability index is not always enough. You truly need to understand your subject in your area so that you can work with the type of data, the statistical information that's going to get you to a good, robust understanding of what the needs are and what the social stressors are in a given area. Another example is one I mentioned earlier, in that the SVI does not include internet access, which is a basic necessity in today's world. We were able to mine that information elsewhere from the census data, and that helped with our communication strategy. We have not yet layered that onto this map, but we're going to be looking for an opportunity to do that in the coming months so that we have all of this information and can visualize it at a spatial level and understand what are the compound overlapping issues in different places. And so the point I want to make here is to understand that the SVI is a good starting point, but it's sometimes not enough. understanding the problem that you need to address, the variables that may influence your thinking. You need to identify and sweep in other relevant data or statistics. Now, I've gone ahead and listed some ideas on the slide, but these are by no means exhaustive. So for instance, if you had a physical event coming down the pike, you might be more concerned with mapping emergency service locations or medical facilities. Or if we were looking at a potential flood event, where the flood zones were located, there are data layers that can be looked at in terms of projected storm tracks and what's in the way of an oncoming storm. We talked about the internet access issue. And just in preparing for this presentation, I tripped across yet another tool just yesterday that's created by FEMA. It's the RAPT tool that provides many more robust tools for possible layering, including a built-out environment that may be important if you're dealing with a physical event. And it's something that we'll be exploring to see how else that might be able to benefit us with the work that we're doing at CCC for COVID. So Social Vulnerability Index and its themes and its subcomponents can give us a ton of information, help us narrow the focus, do better at reallocating our resources. But at the same time, we need to be mindful that that may not be the whole picture and look for other relevant variables. So I want to talk a little bit about what we learned and the actions that we took. Of course, I talked about the gaps that we identified. We were able to add coverage and we pushed communication of all available facilities. We also found some areas of potential overlap where there were some pretty strong emergency food distribution centers and also periodic mobile pantries coming into the area. Now, that's not an assumption that it's an overlap. There could be reasons why because of the days and hours of these fixed facilities, but it gives us something to pursue in terms of understanding whether there is a redundancy or not. We could also more easily assess whether the solution should be a fixed versus mobile location. As I mentioned earlier on the transportation and mobility factor, we could visualize that. We could actually, the map can help you measure the distance from where a vulnerable population may reside to where the closest emergency pantry would be located. We spearheaded a community drive for resources we didn't have, and we developed a much more comprehensive electronic and manual communications plan to broaden public knowledge of available resources and locations. And that included flyers produced in 3 languages, English, Spanish, and Haitian Creole. We had not been aware that there was such a large population on the western side of the county that we could help with this project that we were doing. And as I mentioned, we identified several issues that we felt could warrant further study. And so we did a little report card for ourselves as well. And I think the biggest success we feel that we've had is leveraging the power of networking to communicate and share knowledge and resources, building these mapping and analytic tools that are truly still a work in progress, and collaborating and improving to partner on delivery of services. We were able to extend the collective reach of finite resources. One example was that the school district significantly reduced the need for one-off emergency food deliveries to at-risk student families because of the information we were able to push out to the community. And we were also able to supplement basic groceries with other essentials. We have a much better systemic grasp of the food resource network in Sussex County, as well as the local community stressors that affect that and other dynamics that we're involved with working in. And that's helpful in another regard in the event of an emergency, or if one of these facilities were to be destroyed or go offline for any reason, we're in a better position to create a backup plan and to hit the ground running. We've had a lot of positive engagement with successful drives and volunteers with a strong sense of social responsibility, as well as advocacy through published commentaries. And we've realized the potential to replicate this model throughout the state. We introduced the mapping tool that we built to the Delaware Department of Agriculture, and they adopted that map and worked in conjunction with the University of Delaware and the SNAP program to extend that statewide to track and disseminate information on food distribution resources. Still a work in progress for us, collaboration with county and state resources. We are developing those relationships, finding out how we can interconnect, what role we can play to support their role in an emergency, or how they might assist us with resources. We can be better prepared to hit the ground running with better relationships. We might even have the potential to expedite grants if we already have a lot of the groundwork done, as well as a more efficient and impactful resource allocation. We still need to increase our learning curve on the mapping and analytic tools. As I said, this is really just the first stake in the ground. And we're also looking at CCC for COVID sustainability. We are an all-volunteer small coordination team with 80+ members. And what will we be going forward? And we're currently engaged in looking at whether we should become a permanent COAD, a community organization active in disasters. I do want to go back to the prior slide just for 1 second, because I wanted to point out that the asterisk items were ones where the social vulnerability index and other social stressors were key analytic components that enabled us to be more effective and learn more in those scenarios. And so that turned out to be a terrific tool that we learned about in the course of this year. And we're also understanding, we have a much better picture of Sussex County and what our social stressors are. And it's not just about vulnerable populations, it's about vulnerable businesses as well. We're highly dependent on small business. We have some sectors within that very vulnerable to economic downturns and weather disasters. Almost a third of our residents are in 20,000 or less. And there are so many people on SNAP benefits, 88% were at least one working member. There's one working member in the household, and yet they still depend on that. I think we all know there's an acute shortage of affordable housing, which will only be magnified in the event of any disaster, whether it's physical or a pandemic like we're dealing with now. And there's no financial cushion for many of these people living day to day. And so there are many, many aspects to this that it's opened our eyes to by overlaying the social vulnerability index and trying to get a feel for how do we solve this one problem. And now we can use those tools to begin to tackle some of the others that we're referencing here. So I'm going to stop there. The next slide, which will be shared with you, has a list of all the links that will get you to the places that we talked about here and resources. These are the kinds of tools that you really have to play with to understand how they may come to help you in terms of what you're doing and the kinds of problems that you need to solve. And so with that, I just want to say thank you, and my circles persist. Clear all my drawings. Okay, I just want to say thank you very much for the time to go through this with you, and I'll turn it back over to Lisa.
All right, thank you, Patty. My goodness, that was impressive and inspiring. And boy, you partner that with Tiffany's presentation. It's very heartening. It's very heartening. So we have a lot of questions. I did want to mention that we are going to put a few of the links in the chat box, specifically the social vulnerability index, so people can have them right handy. But as you said, we will be getting a lot of these resources out to everybody afterwards in our follow-up. But we've got several questions here, so we're going to take some time for that. Patty, specifically one for you, that you had mentioned the food availability, focus to food availability. What else is CCC for COVID working with or planning to focus on?
Well, there are many things on the plate. Because of the way the pandemic hit the area and the speed with which things escalated in the early months, we were preliminarily focused on the bottom rung of Maslow's hierarchy of need, food, shelter, et cetera. I talked about the fact that we research. Once we research, sometimes we find others are working on it. We did a substantial investigation on internet connectivity and a broadband report covering all the school districts in Sussex. And just about that time, a lot of CARES dollars came down the pike at the state level, where they are focused very heavily on getting connectivity in place for the school students throughout the state. There's an opportunity for 26,000 students to get subsidized connectivity, MiFi devices, et cetera. So we didn't need to delve into that, although we do see some gaps. That addresses the school children, but we also are concerned about senior isolation. We have a subgroup that is ongoing attention on the senior population, doing wellness checks, finding ways to stay connected. And we're just beginning to examine the connectivity issue for them as well. And then another piece that we are just beginning, the pandemic unfortunately has heightened, as we all know. And so we are back now dealing with issues on the food resources front that were starting to alleviate as people were going back to work, but now it's worsening again. But the other connectivity issue, the dollars came down the pike for the governor's rapid workforce retraining and redeployment initiative. And the concern is, well, if you're out of work and you're in a vulnerable area, you're probably not likely to have connectivity or a device or one of those two. And so we're just beginning to look into what might we do or our partners be capable of in assisting or at least facilitating that connectivity so that they can participate and take the next step to enroll in these programs. So those are some examples. We have chambers of commerce and businesses as members as well, and we continue to look for opportunities to assist the small business environment, but we don't have our arms around anything on that concrete as well. It's hard to believe it's only been 9 months since we began our existence, but we'll continue to stay focused to see how much deeper we can delve to help to fix some of those issues.
And I think, as you had mentioned, maybe in a previous conversation, so much of this is transferable, which is so wonderful. You've really created a format for all of this. One more question for you, and then we'll go to Tiffany. Of course, someone is wondering, as probably many of it, how were you able to get this surge of community engagement so quickly?
I think, first of all, we started out, we're a small group of coordinators. I think we're 5 altogether. Word of mouth from the partners, and then just jumping in and starting to solve issues. And then as we did our investigation and research and started calling around, it was kind of a double-pronged approach. We were able to engage more people in the idea of CCC for COVID as well. And so that word of mouth referral spread, et cetera. And we ran into some issues where we pulled in some business partners that were able to help and coordinate with us. So it was partly us reaching out and them reaching in.
Okay, great. Man, so much here. Tiffany, obviously an element that you're focusing on so much, and that whole accessibility. What are some of the challenges to gaining access to those vulnerable communities?
I would say first is having authentic community engagement has been a barrier because a lot of government entities have not ever tried to engage their community or their community-based organizations or even businesses when they're trying to do these projects or introduce these policies. So there's a lack of trust between the communities and those entities. So taking the time, really time is always a barrier because you need to take the time to actually build those relationships and even partner like Patty did with community-based organizations or people who are already on the ground doing the work so that the relationship can be built from an existing partner. Just being smart about who you're choosing to work with to ultimately create and kind of grow trust between all the entities that are involved. But a lot of government entities don't take that time, and a lot of businesses don't take the time, so they're never really going to be trusted, and it's hard to get proper feedback from people who don't trust you. So I think that's probably one of the biggest barriers of equitable adaptation in general.
Right, which leads into that second part then. If you're not getting the accurate information, you're not going to
be what the community wants. Yeah. And you're going to get a lot of pushback, or it's not going to be helpful. It might be a waste of your time, might be a waste of money. And it's just, not what was wanted. So you definitely want to hear from community before you do anything, before you waste any money or before you implement something that may do more harm than good.
And guidance for this is in the toolkit?
Yes. There's the community engagement chapter. And in that chapter, there are a lot of action items that community organizations or governments can take to be able to build that trust and to build these relationships, as well as how to work with other communities, how to make sure when you're hosting a community engagement meeting, how to do that after hours, making sure it's not during work so that more people can be included, paying community members, providing childcare, like all different ways that you can make sure that you're reaching the broader community and that you'll get authentic information out of these meetings and discussions and partnerships.
Right. So I think we'll take 5 more minutes here. So maybe to both of you, someone was asking that they didn't notice any energy or electricity factors in the SVI.
Let me jump in first, and Tiffany might want to jump in. There are things missing. I think it needs to be updated. I think that, you know, I was thinking about another factor, how much of your population are employed in service level jobs where their income level is probably below a working wage. I think that is an extremely important thing to understand when you're dealing with resilience planning or recovery after the fact. All of your utilities can become important there. So I think it's probably time for the CDC to update that. But you can, I did not come across, we were mostly focused on the social factor side of things. There were a few physical factors like mobility that impacted, that we looked into. But if someone is looking, you know, at more of a physical event, I'm going to guess that wrapped product I just found yesterday may have more of those sorts of infrastructure components that could be of some help, because sure, you would want to know where your substations are, as well as other issues that might affect the population.
Tiffany?
Yeah, I would agree with everything Patty just said. It definitely needs an update, and that's why a lot of states are kind of taking on their own tools, like Maryland and like California did, to make it more specific to their own communities and making tools that are more specific to their own problems, like infrastructure mapping or flood mapping, or, you know, whatever kind of map that you may need. It may be a matter of just using different resources to, you know, get the final answer, or creating something new that incorporates all those different indicators in one.
And then maybe finally, one thing that has come up repeatedly, including this morning, was the whole idea of the broadband access and how critical that is, and seen as an economic development hindrance for some time, but the pandemic has really brought it out. How can we get the investment we need to have that broadband access?
I can talk about that probably in another entire session. I'm happy to share a report that I did for CCC for COVID with this group as well. There's a lot of money was spent. Towers have gone up. It's expensive. It's $25,000 to $30,000 per mile of broadband if you put it in the ground, or, you know, use a cable. But the fixed wireless, which is not the same as your mobile access, is actually offering as good a solution. Some money was spent on equipping the towers to accommodate that. But as the money came down from the CARES Act in order to get the school children connected for their programs, they ended up taking the route of mobile Wi-Fi devices because the money's running out on December 31st. They need to get it spent. They need to do this rapidly. And so there's going to be, an above average reliance on the mobile wireless side of things, where I think we should focus then, as that settles in, to get more and more people over to the fixed wireless and the broadband piece. The problem here is we're rural, we're flat, there are a lot of trees in the way. It is a very difficult process to do the broadband wiring, but the fixed wireless has pretty good capabilities. I'm happy to answer any questions and share that report offline if people want that.
All right, well, I think we're gonna have to end this part right now. My goodness, Tiffany and Patty, thank you so much. This was just such valuable information. You know, the insights and the experiences you've had, so great to share. You've planted a lot of seeds for the discussions that we're going to come into now, and coordinated action, hopefully. So everybody sit tight, don't go anywhere. We're just going to take a couple of minutes and get everybody set up in the different rooms. You should be automatically entered into a room, and then otherwise you can click to accept. There will be a facilitator in each room, and they can help guide the discussion and also capture input from the questions we'll be discussing to share later. And the two questions that we are going to be addressing, as you'll see here, is what insights or strategies from our speakers resonated with you most? And how might your municipality or organization use the tools discussed today to identify and address the needs of vulnerable communities specifically? That's a lot, but hopefully this is going to be an ongoing conversation, but at least this will get us thinking and connecting with each other and maybe asking some of the right questions. So hang in there and we'll be right back. And again, check the chat box for any links that we've been putting in there for you.